Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on liver and pancreas disorders, hepatitis, cirrhosis, pancreatitis, with 4 answer choices and detailed explanations. Liver and pancreas disorders, clinical vignettes, viral hepatitis serology interpretation. A 30-year-old man presents with fatigue, jaundice, and dark urine. Laboratory tests show HBsAg positive, anti-HBc IgM positive, anti-HBs negative. What is the most likely diagnosis? A. Acute hepatitis B infection, B. Chronic hepatitis B infection, C. Resolved hepatitis B infection, D. Hepatitis B vaccination. Answer A. Acute hepatitis B infection. Explanation: HBsAg positivity plus anti-HBc IgM positivity indicate acute hepatitis B infection. Chronic infection would have IgG, while vaccinated individuals have anti-HBs positivity only. Alcoholic liver disease versus non-alcoholic fatty liver disease. A 50-year-old man with a history of heavy alcohol use presents with jaundice, hepatomegaly, and elevated AST and ALT. AST-ALT ratio is 2 to 1. What is the most likely diagnosis? A. Alcoholic liver disease. B. Non-alcoholic fatty liver disease. C. Autoimmune hepatitis. D. Wilson's disease. Answer: alcoholic liver disease. Explanation: 2 to 1 is highly suggestive of alcoholic liver disease, as alcohol-induced mitochondrial damage increases AST more than ALT. 3. Cirrhosis and portal hypertension. A 56-year-old man with cirrhosis presents with abdominal distension and lower extremity edema. Exam reveals shifting dullness. What is the primary cause of his symptoms? A. Decreased albumin synthesis. B. Increased hepatic venous pressure. C. Decreased bile production. D. Hepatic encephalopathy. Answer B. Increased hepatic venous pressure. Explanation: portal hypertension due to cirrhosis increases hydrostatic pressure, leading to ascites and varices. F4. Hepatic encephalopathy. A 65-year-old man with cirrhosis develops confusion, asterixis, and lethargy. His ammonia levels are elevated. What is the best initial treatment? A. Spironolactone. B. Lactulose. C. Acetylcysteine. D. Rifaximin. Answer: lactulose. Explanation: lactulose acidifies the colon, converting ammonia NH3 into ammonium NH4 bis, which is trapped in stool and excreted, reducing hepatic encephalopathy. 5. Wilson's disease. A 20-year-old man presents with tremors, personality changes, and jaundice. Exam reveals Kayser-Fleischer rings. Which laboratory finding is expected? Low serum ceruloplasmin. B. High serum iron C. Increased ferritin. D. Low transferrin saturation. Answer A. Low serum ceruloplasmin. Wilson's disease is a disorder of copper metabolism caused by a mutation in ATP7B, leading to low ceruloplasmin and copper accumulation. 6. Acute pancreatitis causes. A 42-year-old woman presents with severe epigastric pain radiating to the back, nausea, and vomiting. Labs show elevated lipase. Which of the following is the most likely cause? A. Alcohol use. B. Gallstones. C. Hypercalcemia. D. Hypertriglyceridemia. Answer D. Explanation: the 2 most common causes of acute pancreatitis are gallstones, 40 to 50%, and alcohol, 25 to 35%. Gallstones obstruct the pancreatic duct, leading to enzyme activation. 7. Chronic pancreatitis and exocrine insufficiency. A 55-year-old man with a history of alcohol abuse presents with chronic diarrhea and weight loss. His stool is fatty and malodorous. What test confirms his diagnosis? A. Serum amylase. B. Fecal elastase. C. Serum lipase. Lactose hydrogen breath test. Answer: fecal elastase. Explanation: chronic pancreatitis leads to exocrine insufficiency diagnosed by low fecal elastase, indicating poor pancreatic enzyme production. Pancreatic cancer and painless jaundice. A 67-year-old man presents with painless jaundice, weight loss, and pruritus. Exam reveals palpable gallbladder Courvoisier sign. What is the most likely diagnosis? A. Hepatocellular carcinoma. B. Pancreatic adenocarcinoma. C. Cholangiocarcinoma. D. Chronic pancreatitis. Answer B. Pancreatic adenocarcinoma. Explanation: pancreatic head tumors obstruct the common bile duct, causing painless jaundice and a palpable gallbladder. Hepatocellular carcinoma and tumor marker. A 62-year-old man with a history of hepatitis B and cirrhosis presents with abdominal pain and weight loss. CT shows a liver mass. What tumor marker is most useful? A. Carcinoembryonic antigen, CEA, B. CA19-9, C. Alpha-fetoprotein, AFP, D. beta-HCG. Answer C. Alpha-fetoprotein, AFP. Explanation. Hepatocellular carcinoma, HCC, is associated with AFP, especially in patients with chronic hepatitis B or cirrhosis. At 10. Hemochromatosis and liver damage. A 55-year-old man presents with fatigue, diabetes, skin hyperpigmentation, and hepatomegaly. His ferritin and transferrin saturation are elevated. What is the most likely diagnosis? A. Wilson's disease. B. Autoimmune hepatitis. C. Hemochromatosis. D. Alpha-1 antitrypsin deficiency. Answer C. Hemochromatosis. Explanation. Hereditary hemochromatosis, HFE gene mutation, causes iron overload, leading to bronze diabetes, liver cirrhosis, and cardiomyopathy. Key takeaways for liver and pancreas disorders. Hepatitis B, HBs plus IgM anti-HBc equals acute infection. Alcoholic liver disease, AST-ALT21. Cirrhosis, portal hypertension, ascites, varices. Hepatic encephalopathy, treat with lactulose. Wilson's disease, low ceruloplasmin, Kayser-Fleischer rings. Pancreatitis, gallstones and alcohol are most common causes. Chronic pancreatitis, fecal elastase, exocrine insufficiency. Pancreatic cancer, painless jaundice plus Courvoisier sign. HCC, associated with AFP and hepatitis B. Hemochromatosis, iron overload, bronze skin, diabetes, cirrhosis. Would you like another set focused on GI infections, biliary diseases, or metabolic